नमस्कार, मैं दिनकर कुलकर्णी। मेरे भाई विनायक कुलकर्णी, मेरे भाई को अल्सर के प्रॉब्लम से हम एक हॉस्पिटल में बताए, पर वहाँ पे बराबर देख नहीं सके, सर्विस मालूम नहीं हुआ। और क्या है, ब्लीडिंग ज़्यादा होने से बहुत क्रिटिकल थे, ब्लड भी कम हो गया था। फिर कोई किसी ने बताया यशोदा हॉस्पिटल, तो मैं यहाँ पर लेकर आया हूँ। लेके आने से जो है उनको धीरे धीरे डेवलप करते करते कुछ अपना इंडोस्कोपी करने से जो है पिन वगैरह लगाए, 1 से 2 बार इंडोस्कोपी करे, उसको कैच करने से पिन वगैरह लगा कर एक 4 डेज 5 डेज आईसीयू में रखे। उससे क्या है, उनको ब्लीडिंग कम हो गया, रुक गया। फिर 1-4 दिन का ब्लीडिंग होने से फिर से सर लोग डिसाइड करें कैसे करेंगे, कैसे करें। एकदम क्रिटिकल कंडीशन थे, ब्लड 3.5 आ गया था। उसको डेवलप करके आईसीयू में रख के करेक्ट रख के जो है फिर से उसको सर्जरी के लिए रेडी करें। और सर्जरी होने के बाद रात में जो है एक 11 o'clock ऐसा होने के बाद वेंटिलेटर पे आईसीयू में लेके गए। आईसीयू में लेके आने के बाद 48 आवर या 72 आवर्स का टाइम दिया डॉक्टर लोग। तो उसमें जो है अब सुबह उठते कि जो हमको अच्छा है 48 और 72 आवर्स टाइम दिए। हमारे अरुण अरोड़ा सर के साथ हाथ में केस था, बहुत अच्छे से, बहुत अच्छी सर्विस, इतनी सर्विस पूछो मत कि बहुत अच्छी। और अपने सुरेंद्र रेड्डी सर सर्जन, बहुत एकदम नंबर 1, जैसे कि प्रभु भगवान उस टाइप में सर्विस है। और अपने यशोदा हॉस्पिटल की जो है नर्स डॉक्टर्स जो भी है, एक बहन, एक माँ, एक बेटी, वो टॉप लेवल की सर्विस से मैं मानता हूँ। मैं अच्छा हूँ, सेटिस्फाई हूँ इस सर्विस से। ये अरुण अरोड़ा सर थे, सुरेंद्र रेड्डी सर थे, यानी साक्षात भगवान का अवतार बोल सकता हूँ मैं। बहुत खुश हूँ मैं यशोदा हॉस्पिटल मलकपेट सर्विस से, बहुत शानदार सर्विस में हूँ, बहुत अच्छा है मेरे को।
Hello, this is Dr. Tokala Surender Reddy, General Laparoscopic and Robotic Surgeon. I am working in Yashoda Hospital, Malakpet branch since 21 years. Recently, I have operated one of my patients, Mr. Vinayak Kulkarni, who was admitted in our hospital in acute medical care unit with complaints of gastrointestinal bleeding. Endoscopy was done. There was a bleeder. Medical gastroenterologist has done a clipping of the vessel, and temporarily the bleeding has stopped. Patient was doing well for 48 hours. He was kept under observation in acute medical care unit. But one day late in the evening, I got a call saying patient is continuous bleeding per rectum. That is, we call it as hematochezia. Then I have seen the patient. Patient was in hypertension. He was on ventilator. BP was not recordable, and he was quite pale. And already seen by the medical gastroenterologist. Medical gastroenterologist was bedside, and he gave me a call saying patient needs surgical intervention to stop the bleeding. As once medical attempt, that is endoscopic attempt, has been done, and now he is rebleeding. Then we took him up with no blood pressure, with a grave consent. We explained everything to the patient attendants, wife and brother, and they were so cooperative. BP was not recordable, even though he was on inotropics and blood transfusion was going. There was a big blood vessel which was bleeding from the ulcer bed, and it was pumping out, gushing the blood. It was a big blood vessel. On doing duodenotomy, the opening of the duodenum, this was the finding, and the transfixation of the vessel was done. And post-operatively, patient recovered well. We have witnessed the patient almost on the deathbed, and finally, with efforts of our medical gastroenterologist who was accompanying the patient throughout, my team of my surgical team, I am also thankful to, and we are thankful to the organization when they have said just go ahead for everything. There was no obstacle at all, and the patient is doing well, he is alive. Thank you.
Hi, I am Dr. Arun, gastroenterologist from Yashoda Hospital, Malakpet. I am the consultant gastroenterologist here. I am working with the very good gastroenterologist team here. So here I am going to tell you about a case which we have managed here. A 50-year-old male patient came with complaints of upper GI bleed. He was referred from outside hospital actually with active hematemesis. So he was referred here for angiographic embolization. We as a gastroenterologist team, initially we did upper GI endoscopy and we could see the bleeding from the duodenum. So we thoroughly washed the duodenum and we could identify the ulcer in the posterior inferior wall of the duodenum, and we could identify active spurter. So what we did is we did an endoscopic clipping. Adrenaline injection and endoscopic clipping was done and the hemostasis was achieved. So the bleeding stopped immediately and the patient is fine for first 3 to 4 days. So after 3 to 4 days we are about to plan to discharge in couple of days, but patient again presented with melena. So we did a recheck upper GI endoscopy and there was active gush of blood. So we referred immediately because we could not identify the due to lack of vision. We immediately shifted the patient to OT and emergency surgical explorative laparotomy was done and the bleeder was identified and the arterial bleed was ligated. So we could save the patient actually. If we have delayed in making a decision, we could have lost the patient. So here timely management and timely intervention from the Yashoda hospital, both the surgical gastroenterologist and the medical gastroenterologist team have saved the patient. I thank Dr. Surender Reddy sir for his timely intervention and he response and for his quick response immediately shifted the patient to OT and exploratory laparotomy was done. And big thank you to Dr. Surender Reddy sir.